Today we're going to talk about the MSPE, or Medical Student Performance Evaluation. We've gotten a lot of questions on those, and hopefully I can clarify some of it. First of all, it is a letter of assessment. It's not a letter of recommendation, and it is written by the Office of Student Affairs. This letter of assessment summarizes your academic career from matriculation until the end of your third year. The information is going to come from a number of different sources, and we're going to go through the different parts of it now. The first is the identifying information. That's going to give your name, year in school, as well as the name and location of the school. This is going to be inputted by the Office of Student Affairs. The second is your noteworthy characteristics, and we're going to go a little bit more in depth with that because that's the thing that you are going to be working on. Now, the LCME requires that all medical schools release their MSPE on October the 1st. And that, of course, is to maintain fairness across medical schools because that's kind of the last thing that's going to be part of your application package to residency program directors. And if the last item is released on exactly the same day by all of the medical schools, you can see that that helps maintain that fairness or consistency. So with that in mind, we want to have a timeline that's going to maximize the information that we can provide, but at the same time, try to put out the best product that we can. And for that reason, I've sent out an email describing, first of all, what an MSPE is, and secondly, giving some examples of noteworthy characteristics. And the purpose of that is to give you some ideas of what you can write. We'd like to have all of the noteworthy characteristics in by May the 1st. For the noteworthy characteristics, your submission should include 3 bulleted sections written in complete sentences, with each section approximately 50 words or less, and a total of all 3 sections 150 words or less. Now, some students have gone over for a few words and they've asked, is it character delineated, and therefore are we going to have to cut part of their content? And the answer is no. The guidelines for the number of words is not that strict. These are just general guidelines for you to give you an idea of what kind of length you're looking at. A second question that I've had is, what if I send in my noteworthy characteristics and something would happen between now and October the 1st that I feel is a better characteristic or a better achievement than one of the ones that I had already submitted? Not a problem. All you need to do is send me the updated noteworthy characteristic and which one you want it to replace. And we can replace it in your noteworthy characteristics and still have it ready for October the 1st. The second question that I get is, if I send in my noteworthy characteristics to you, what if when you read it, the English is not exactly right, or your verb tense doesn't agree, or I'm reading your noteworthy characteristic as something different than what you intended? What we'll do at that point is I will give you a few suggestions or edits and just send it back to you. You can accept those suggestions or edits, or you can decide you want to keep it in the original format that you've had it. Now, the purpose of your noteworthy characteristics are to give some meaningful contribution that you have made in the area of leadership, research, extracurricular activities, community service, academics, global health, whatever it is that's important to you. Now, I've been talking to the first and second years and telling them to develop a brand. A brand is what you see yourself as a future physician. Is community engagement, community service really important to you? What about hospital administration? What about serving the underserved? What about research or academics? Think about which one matters to you. I tell the first and second years you should choose your activities based on your brand. Don't go doing a bunch of things. This isn't your application for medical school. What you're looking at is to do the things that are most directed towards your brand, so that everything is cohesive and you can fully explain why you want to do what it is that you want to do. Now, of course, you've got to be careful. Don't plagiarize. Make sure you write in complete sentences. Don't write about your undergrad. We really want to know more about your medical school achievements, not your undergrad achievements. But if you did something, like a Rhodes Scholar or something that impressive, well, then, of course, include it at that point. Don't make a list. We don't want to know about every research project you've ever done. Instead, we'd want you to pick out what's the general category of research that you've done, and then possibly talk more in depth about one project, especially something that you took from beginning to end. Came up with the idea, went all the way through IRB approval, and then collected the data and wrote the paper and even published it. That would show them that you know that research procedure from beginning to end. Community engagement We don't really want a list of all the things that you've done as far as being out in the community. I went to this and spent 4 hours here and 3 hours here and 2 hours here. No, think about community engagement in terms of what does it matter to you as far as community engagement? Is it providing health care? Is it educating young people? Is it making a difference as far as inventing something or entrepreneurship? What exactly is it in community engagement that matters to you? And then use examples from your CV to back that up. So if you say to yourself that medical care to the underserved is what really matters to me, and you have 100 hours of service at a free clinic, well, that's important. Or what if you went home on the summer break and spent 3 weeks in a free clinic? And then maybe even bring in something from undergrad, say, this has been a consistent passion of mine. Even throughout undergrad, I did much more than the required 100 hours of community service. So you can see that you're trying to show them who you are and what matters to you. So don't make a list. Don't use any summative statements. I did the following things and they resulted in this. Don't make any comments about things that are irrelevant or things you really don't want to talk about in your interview. So if you, be careful about political or religious affiliations, or maybe something that you might not want to fully explore in your interview. So I sent out some examples for you as far as things that you can think about. Now, all of these I wrote very quickly in about 5 or 10 minutes or so they're not as in-depth as the ones that you're going to be thinking about. But just some examples. Ms. J states that community engagement has been her passion throughout college and medical school. She's completed over 100 hours at the free clinic and sees herself practicing primary care in an inner city setting. Okay, that sounds good because it shows that community engagement is what you're interested in. 100 hours is quite a number of hours, so that really shows that this isn't something you did to check a box. I would only put primary care if you're sure that all you're going to apply for is primary care, okay? Don't mention any specialties in this because you never know what you're going to rule out in the future, and you don't want to box yourself in too much. Or Mr. J comes from a small rural town that he describes as having only one stoplight. This kind of gives me an idea of what your background is. Everyone in town knew the family physician and knew everyone. Mr. J has a strong interest in being in primary care and being the medical provider for many generations of family in his town. He describes one of his strengths as a willingness to learn all facets of a patient's determinants of health and the patients to just sit and listen when the time is right. You can start to get a mental picture of what Mr. J looks like, and if he was in my residency program, what I could expect from him. Now, why do residency programs care about your noteworthy characteristics? What they're trying to do is they're trying to build a very diverse class. So if you've got 6 spots for first-year residents, you have to think to yourself as a residency program director, what do I want to have in that 6 spots? And how can I use part of the application to quickly screen and see if I have people in all those slots that I would really like? Is research important to my program? If so, having students that know how to take a project from beginning to end who are published, that's really important. Having a student that has been, data gathering for 10 different research projects and have their name on there, that's not what I want, okay? So if you did that, make sure you are clear on which one of those categories you would fall into on your MSPE. And if it's the second one, that wouldn't be the thing that you would include. If my residency program has, community engagement and wants people who are really interested in that and serving the public, then you want to make sure that they're aware that that's an interest of yours and the number of hours that you have spent doing that. So what are you going to do if you really have absolutely no idea what to write for your noteworthy or meaningful characteristics? One, you can make an appointment with me. We can sit down and discuss it. You can talk it over with some of your colleagues and see, what do they see in you when they think of you as a future resident or family members. And then possibly we'll develop some MSPE writing sessions where people can kind of get together and bounce ideas off of each other. Okay, so hopefully that gives you a better idea of the noteworthy characteristics. We're going to move on down here. Academic history is going to be month and year of matriculation and expected graduation, any extensions, gaps, breaks, or leaves of absence in your education. Now, of course, we hope you don't have any of those, but some of you have breaks in your education for very important reasons. You've gone off to do some great adventure during one year and came back after that leave of absence. Make sure that's in your noteworthy characteristics. Speak to that so there's no confusion about what that extra year was, because sometimes people will just look at the dates and see 5 years of medical school without actually looking more closely and seeing that you were off in some foreign country gathering experience and learning how to engage and develop programs, or your dual degree and going to be coming with a background, an MBA or an MPH background that's going to be very valuable to their residency program. Academic progress, performance in your clerkships. Now what happens there is every time you complete a clerkship, you're going to get an evaluation, and they're going to have a MSPE area and a non-MSPE area. That MSPE area or statement is what's going to be copied and pasted directly into your MSPE. So once you have you've taken your 30 days and looked that over and made sure that you had no problems with any of its content or noticed any inaccuracies or anything like that, our job here in Student Affairs is strictly to copy and paste it into your MSPE. Okay, so that one's very straightforward. Take the time to read those as you complete each clerkship. It's important. You also want to watch out for professionalism. Make sure that you weren't late, frequently absent, unprofessional. Any of those can be commented on in your clinical statement. And then be aware that your narrative clerkship comments cannot be edited. However, after your 30 days are over and your clerkship grade has been received and we've copied and pasted into your MSPE, what we will do is ask permission to send it to you as a PDF for you to read it. And as you read it, you'll be able to correct any inaccuracies once again. So if you would see, your name is wrong, or the dates that you did something were wrong, or they got you confused with someone else, or something like that, which we should hope it will never happen. But if that would happen, you have that opportunity to read through your entire MSPE before it gets sent out to your residency programs. All right, professional performance, any violations of our professional policy and how the school assesses it is a recommendation from the AAMC to be included in the MSPE. The summary is a summary or a summative assessment. Now, currently we do use the quintile system, and that's going to change with the new curriculum, but that's one way that you can be assessed. Frequently, there is a single adjective that goes along with these quintiles, and that also is part of that summary assessment. So I think I've gone over the majority of questions that I've been asked. The deadline, once again, for the noteworthy characteristics is May the 1st, but they can be edited after that and updated after that if needed. Will you have a chance to review your MSPE before it goes out? Yes. You will have a chance to do that. If you don't agree with a clerkship evaluation or grade, what do? You have that 30-day period and talk about whatever it is that isn't right in your opinion based on that. The rotations that are included in your MSPE are all of your third-year rotations. The earliest date that the MSPE can be sent out is October the 1st. So hopefully this has made the MSPE process a little bit more clear. If you have any additional questions, please let me know, and I will try to answer them. And then also let me know if videos of this sort are worthwhile to do or not. Well, have a good rest of the day.